First up, we'll have Representative Hicks. If you can move forward with your House File 661. If you want to move to the testifying table.
Chair, I'm going to try to have
Yes.
some recorded testimony,
Okay.
so I'm going to try to hook up the laptop.
Sure. Go ahead and hook that up, and we'll let you, when you're ready to go, just give me a thumbs up. I am going to sort of just also get you set up with your amendment as well, Representative Hicks. The chair will offer an amendment or move the amendment to your bill. An author's amendment. Do you want to talk about that first, Representative Hicks, and then play the video, or do you want to play the video first?
We can talk about the bill first, Chair, if that's okay.
Sure. Go ahead and just describe the bill with the amendment as I have moved it, and go ahead when you're ready, Representative Hicks, to House File 661.
Thank you so much, Chair, for the opportunity to speak on House File 661. I'm excited to be joining your committee today to talk about the innovative program that's proven very successful in southern Minnesota. As many of you probably know, Rochester is home to Minnesota's largest private employer, the Mayo Clinic, with over 51,000 Minnesotans employed today. This program, known as the Bridges to Healthcare, initially launched in the Rochester area and has expanded throughout southeastern Minnesota to include Albert Lea, Austin, Faribault, Owatonna, Red Wing, and Winona. Bridges to Healthcare is a public-private partnership that helps non-traditional students transition to a lifelong career in healthcare, Minnesota's current largest industry. These careers provide a livable wage, benefits, and help meet the workforce needs we all know we're facing today. Many of the students and graduates of the program are non-traditional students, perhaps older in age, first generation, use English as a second language, or other things that create unique opportunities for them to enter our healthcare field. This partnership program provides a pathway and support to students to gain the experience and the education in order to pursue professional training and available certificates and degrees. Examples of possible roles include things like certified nursing assistants, patient care associates, phlebotomists, home health aides, administrative supervisors, and registered nurses. The program received $750,000 each year in the last biennium from the Workforce Development Fund. And due to ongoing success and expansion, this bill seeks to maintain that level of funding and continue our expansion efforts and the great success that the program has demonstrated. To share more about the program, I have some in-person testifiers and some virtual testifiers. In your packet, you also have a fact sheet that will give you some more information. And the amendment that I have just clarifies that we're not using any of these funds for space or infrastructure.
So with that, Representative Hicks, I want to make sure that we make a motion. Again, the chair moves the amendment to your bill. Members, any questions to her amendment? Seeing none, all those in favor signify by saying aye. 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 Any opposed? Your bill is amended as presented. So thank you, Representative Hicks, for that. And Mr. Mullins, are you ready? Is that what you want to do next, Representative Hicks? Okay, Mr. Mullins, welcome to the committee, and please introduce yourself and proceed.
Thank you, Mr. Chair and committee members, for allowing me to speak on behalf of the Bridges to Healthcare program. My name is Kyle Mullen. I'm the Adult Services Director with Workforce Development Incorporated, serving southeastern Minnesota. We are the convening, contract, and administrative agency that oversees this program, but its success is achieved through a partnership with multiple community and technical colleges in our area, as well as adult education providers. So currently we sit with approximately 4,500 open RN vacancies, 2,500 open nursing assistant vacancies. DEED itself acknowledged that the long-term care industry is one that is going to need significant help and attention over the next few years due to demographic and economic shifts. We're currently sitting with an over 10% vacancy rate for those crucial fields. The Bridges to Healthcare program offers us a window of opportunity, an answer to that challenge. So this program that was started several years back in 2011 started showing initial success, and conversations began in 2019 to expand it. It was approved by this committee in 2023, and I am here proud to present that not only have we since then expanded to 8 counties in our region, we've also taken the original targets of supporting 300 students per year that would not have been able to enter into the healthcare industry otherwise. We've left that mark in the dust. We're already over 300 for this year and projected to hit 420 for this biennium. And on top of that, this program, the $1 million that it takes to fund that expansion and operation, as Representative Hicks indicated, is a public-private partnership. 25% of our operating funds come from private sources. It's also important to note that 80% of our students who graduate are from culturally or ethnically diverse backgrounds, and 60% go into that long-term care industry that I just mentioned is a priority for focus in the coming years. This program offers a rare triple win in economic self-sufficiency for the students, often able to support their families and get off of public assistance, is a win for the healthcare industry that is grappling with an intense workforce shortage, and it's a win for the tax base, enhancing the communities and incomes therein. Together, that combines for a very powerful economic boost for our region.
Thank you, Mr. Mullen. Any further testifiers, Representative Hicks?
I'm going to try really hard to use these electronic testifiers.
Okay.
I have a husband who is disabled, and it was very difficult for me to be able to have anything more than a job at a gas station or things like that. So I was working 3 jobs, 2 part-times and a full-time, and running myself ragged, trying to figure out how we could pay for his medication, but we were not going to be able to pay for food. And I ran into someone that I worked with, and she told me about the Bridges program, about how they would help me to pay for school. They would help me to get my classes. They would work with me on a schedule. They would work with me on extra things, you know, just the gas alone. I lived 30 miles away to get to school. You need help getting to class? You got a flat tire? I can help you with that. You guys were always there anytime that there was a roadblock, you know, and the times that you didn't think that you could and that you just wanted to give up, you know, and I can't thank you guys enough for that. I'm not where I want to be on my career path, but I'm at a great start. I can work, make better money, work less. I'm extremely grateful. I'm extremely grateful.
And side note, until I got these video testifiers, I didn't know who it was. And if you are from southeastern Minnesota, you'll understand how funny this is. Of course, one of the video testifiers is a friend's cousin, because that is southeastern Minnesota in a nutshell.
Hi, my name is Rebecca Sullivan. My journey with the workforce development started whenever I applied to Riverland for the LPN RN program. I am very grateful for the workforce because they have helped honestly through everything from covering my shoes and scrubs to the class fees to helping me through a really tough time in my home life and covering my rent expenses, and provided stability during a tough time by helping me with other resources around and helping me with find diapers, wipes, food, anything that I've needed for my kids. You guys have helped. So I am very grateful for all the opportunities that you guys have given, and I just hope to be able to return the favor one day. So I don't know what I would do without the workforce, that's for sure. Everyone here, so.
Very good. Representative Hicks, is there further video?
No, I
that's
think
it?
we're ready for questions.
All right, member questions. Representative Zalesnikar.
Thank you, Chair, and thank you, Representative Hicks. I think this is a great program. My question, with the 300 that you have in the program, is the placement rate for them accepting jobs the same number? Or can you talk a little bit about that?
Mr. Mullen?
Yes, thank you. A majority of the students do end up entering into employment as well as continuing their education simultaneously. Of that 300, I don't have the exact numbers, I can get those for you, but I would say over 95% are going to be either continuing their education or entering into employment. As I mentioned, 60% of that 300 are going straight into the long-term care workforce specifically.
Representative Zalesnikar?
Thank you, Chair, and thank you, Representative Hicks. I think this is a fantastic program in southern Minnesota and expanding, and anything we can do to provide health care support for the workers, really, and for patients coming in to receive the services they need is wonderful. So I think it's innovative what you're doing, and thank you for the presentation.
Thank you. Any further member questions? Again, I just want to have a final, go ahead, Representative Pinto.
Thank you, Mr. Chair. Yeah, and Representative Hicks, thanks for this. I love just the combination of addressing the workforce crisis in healthcare and providing opportunity for folks, just all of it. One small question is Bridges to Healthcare itself like its own entity? Because it looks from the documents like maybe it's the Workforce Development Inc. that is kind of the parent. If you could just talk about, I'm thinking a lot and talk to the chair a lot about kind of how to structure our use of Workforce Development Fund dollars and just having conversations, and so just wondering about that with respect to this one.
Mr. Mullen?
Certainly. So Workforce Development oversees the Bridges to Healthcare program, and through that program, the funds are used to pay for training, for supplies like you saw, scrubs and shoes and items like that, or other barriers, flat tire and such. It also pays for the career counseling folks that provide the supportive walking through other challenges or supports they might have. A lot does go towards the tuition that comes for the training provided by the community and technical colleges and the adult basic education providers.
Okay.
Representative Infant,
Thank you, Mr. Chair. So if this, I think if we did end up advancing this as a direct appropriation as written, I wonder if maybe just something, Representative Hicks, you can talk with House Research about whether it maybe would need to be structured to make it very clear exactly who's receiving the funds from DEED. Because if Bridges to Healthcare is not its own kind of entity, we want to make sure. I know we're quite a few steps away from that, Chair, but just something to look at. Thank you, Mr. Chair. Thanks again, Representative Hicks.
Thank you very much. Representative Mueller?
It's been a while, thank you, Mr. Chair, since I've had my name confused with Mueller and Mueller.
Yeah.
Now that I'm no longer with the Mueller's committee. Representative Hicks, this is an area that Riverland contributes with and is such an asset to our area. We have seen how the benefits of public-private partnerships and how this is supposed to work. I mean, the only way that we're going to be able to continue to expand our workforce and to kind of negate crushing debt that we see with our students is through these partnerships. And so hopefully you just got an alert on your phone that said Mrs. Mueller added herself to the bill. So thank you so much.
Thank you. Representative Hussain?
Thanks for coming and forward for this great bill and work first and creating opportunity. I have a follow-up question. What percentage do you think it's enrolled for second language in this program?
Representative Hicks?
I know it's a large number, but I would be lying if I tried to do it, so I'll look to my testimony.
Mr. Mullen?
I can provide you the specific numbers for the number of participants who have English as a second language. I believe it would be in the 55 to 60% range, but I'm happy to give the exact numbers too.
And how are you reaching out?
Follow up, Representative Hussain.
Thank you. How are you reaching out? I know, Representative Hicks, you have a large new American in your district, and workforce is one thing that we lack of, an opportunity. And are you engaging the community in making sure that they know this is such a wonderful program, it exists?
Representative Hicks?
Thank you so much, Chair. Well, I want to say we have a lot of new Americans in Rochester, but my colleagues across the aisle in their southeastern communities also have a lot of new Americans from different communities. And so it is a priority, I think, for all of the representatives in southeastern Minnesota to make sure that we're making those connections and reaching out to those communities. For specific strategies, I'll turn to Mr. Mullen.
Mr. Mullen.
Thank you. So workforce development offers a wide variety of different programs, including a number that are targeted towards individuals who are new Americans or English as a second language learners. So in addition to the supports there, if we come across somebody who this program matches their needs or their interests, we do share that with them. Due to the years this program's been running, honestly, those communities have got the word of mouth going quite strongly. We have marketing materials available, but even in some of the videos we showed today, is going strongly through word of mouth, and we're exceeding the enrollment targets. So the word is out in southeastern Minnesota.
Good. Thank you for your bill. Representative Hicks, final comments.
Thank you all so much for allowing me to come and present a little bit about this wonderful initiative that southeastern Minnesota in such a positive way. I appreciate your time, and I hope that as it is laid over today, it remains in consideration for the final bill.
Thank you very much for bringing House File 661 forward. As amended, we will carry this bill over to for further consideration in another bill. So thank you for your testimony today.